most importantly, you can't let ego get in the way sometimes too. When you get too in over your head with the medications, and you begin to make some irrational decisions that you otherwise wouldn't make, because you get in that, you get kind of this sense of confidence that you're just cruising, you're just sailing.
Let's talk a little bit about that, because I think that happens a lot with patients. They see getting off the medications equaling wellness and putting the whole operative and post-operative period of care behind them. So that's the goal. I want to get off these medicines. And sometimes I think patients err on the side of getting off the medicines a little too quickly. And that process of coming off medication is called weaning. And weaning off medication can be a very challenging endeavor, even when it's managed by pain experts. So what you're really describing is an acute withdrawal kind of physical response.
Yeah.
And that can be extremely, horrible, to use your terminology.
A total
nightmarish.
A total mental and psychological implosion.
Yeah.
Essentially.
And so I think to avoid that, and I think what we're really trying to help people with and having these discussions and putting this information out there is to help people to understand that these are powerful medications that are given for a very, very good reason, and that they need to be respected, and they need to be given and withdrawn in a very, very meticulous fashion. And so I think that the message I would like people to get from our discussion and you honestly recounting stopping the medication abruptly is that by doing that, even with the best intentions, you can cause some real physical and emotional harm in doing that. Which isn't to say that the medicines aren't important to give. They are important to give, but they're equally important to withdraw in a very, very meticulous fashion. Your inclination to go off the medication in terms of its timing was right on. It was the technique that you used in coming off the medications that created the problem. Because as you know, I tell patients 2 to 3 weeks after you're home, you're going to find that you need to use less of the medication than you did when you first went home. Weaning is as important as the actual taking of the medication. I emphasize how important it is to take the medicine, to keep your pain at a tolerable level from the time that you're discharged. It's equally important at the tail end of that period of time to slowly and meticulously come off the medications. And I think this is an area where I'm going to be very meticulous and repetitive in letting people know that coming off the medication is a potentially problematic period of their recovery, and they need to understand that coming off of it completely will present some real serious problems.
Hey Barry,
how's it going?
Hanging in there, man.
When you're out there doing things that you were unable to do before.
Thank you so much.
You're welcome.